Welcome to my TED Talk. My name is Erin Schloffman, and today's topic is doctors believing women who are in pain or are going through some sort of medical issue, and then the doctors not believing them. We will therefore need to find a solution. Many people in the U.S. visit the doctor's office every year. According to Forbes, Americans visit the doctor's office 4 times per year. However, this is less than other averages, such as Japan, which their population visits the doctor's office 13 times per year. The amount of visits per person to the doctor's office, as well as our advancements in the medical field, should result in higher life expectancies for everyone. However, this is not the case because women are, more often than not believed by their medical complaints. This has been proven time and time again through statistics, laws, and past medical performances. There is an obvious bias against women in the medical field. This bias is unhealthy, unethical, and deadly in some cases. Many men do not see this as a problem because women are too emotional. Most medical schools have noticed this and started to implement classes to help notice the biases of women and help them study the women's body, how it differs from men's. However, this is not enough to have some schools perform these classes. All medical students and current medical professionals have to take these classes so they can prove that their own biases will not take effect in the treatment of women patients. This treatment of women is not a new thing in history. It's been going on for centuries. There's a ridiculous rumor, stereotype, whatever you want to call it, that women faint at the sight of blood. The people who believe these rumors and stereotypes, what do they think that women do when they're on their menstrual cycle? Just faint every time? The sexism does not only apply in stereotypes, but in medical practices as well. Hysteria was a constant diagnosis of women in the 17th and 18th century. Hysteria was a diagnosis that could be ranged from be thinking too much to having legitimate mental illnesses. It was all under one roof so that the men of the society during those ages could control the women that scared them. And the only way to cure hysteria was through sexual relief, which was only performed by the doctors. These biases affect every woman, regardless of their socioeconomic status. According to Dr. Powell, who was interviewed by the New York Times, she is a medical professional herself, and she even has issues standing up to doctors who don't believe her. As time has progressed, multiple researches have shown that women take treatments differently than men. While this is true, researchers and doctors refuse to include women into studies and take into account that less medication is required for women to get the same treatment as men. Due to this neglect, the importance of gender, psychosocial, and environmental factors in explaining the differences in men and women have arguably contributed to the gender-based inequalities in the medical treatments. The treatment of women in society and also in the medical field has resulted in less than optimal care for women. And the resistance to learn and include women into the medical field has systematically resulted in the current treatment of women. Training to be able to identify the biases of medical professionals will be able to lower the amount of women's complaints not being adequately heard. These trainings have been implemented in multiple countries over the past 2 decades. However, these seminars are not being implemented at a steady rate because the uncertainty about what should be included in the curriculum, a lack of practical guidelines for implementation, and the institutional resistance to change has resulted in the neglect of women being heard. These seminars should be mandatory because if the medical field standardizes these classes, more doctors will understand their own biases, resulting in better, more optimal care for women, and while requiring medical students and medical professionals to attend these biases to help reduce and to identify their biases, to help and better the women's health, is the best way to go about this problem. Some people, however, think that there is a better way to go about this. There are some loopholes, though. In 2007, there was a lawsuit against Washington State due to the medical professionals discriminating against minority groups, mainly the LGBTQ community and women. Due to this ruling, there are now new rules in place, such as the self-assessment checklist for compliance and suggested best practices to see if the doctor has any current biases. While this is a test to see if there are any biases that the medical professionals and medical students have, it's just a test. Anyone can cheat on it. We've all cheated on a test at some point in our time. If a professional or a medical student were to take this test and worry that their biases were going to be identified and then either ruin the chances of getting another job or getting them fired from their current job, they would lie about their biases. If someone goes to the doctor for any reason, they should have the benefit of being believed. By reducing women's medical complaints as trivial because they're too emotional, we not only put their physical health in jeopardy, but their mental health as well. As a Yale cardiology study found that many women hesitated to go to the hospital after having a heart attack because they were worried of being labeled as hypochondriacs. Women have to be given the benefit of the doubt because in the past women have not had this luxury. If all medical schools and doctors' office includes classes for women's health and to help identify their biases, women's physical and mental health will increase. Thank you for listening to my TED Talk. Have a great day.